Have you ever found yourself hesitating to stand up because of knee pain? Maybe your knees feel stiff in the morning, or they ache after a short walk around the block. These are common experiences, especially as we get older. But here's something hopeful. You don't have to live with constant discomfort, and you don't always need pills to find relief. In this first part of our series on easing knee pain naturally, we're focusing on gentle exercises, simple movements that can strengthen your knees, reduce stiffness, and help you feel more confident in your steps. These are low impact, easy to do at home, and designed especially for older adults. Why exercise helps with knee pain? When your knees hurt, your first instinct might be to rest, and while short periods of rest are okay, doing nothing for too long can actually make things worse. Lack of movement can cause the muscles around your knees, especially your thighs and calves, to weaken. When those muscles are weak, your joints take on more stress, and that leads to more pain. Research from the American Academy of Orthopedic Surgeons shows that strengthening the muscles around your knees can significantly reduce pain and improve joint stability. That means the more you move, carefully and consistently, the better your knees can feel. 3 simple exercises you can start today. Let's go through a few easy exercises you can do while sitting or standing. These don't require any special equipment and only take a few minutes each day. Seated leg raises. Sit upright in a sturdy chair. Keep both feet flat on the floor. Slowly straighten one leg out in front of you, holding it in the air for 5 seconds, then lower it back down. Do this 10 times on each leg. This movement strengthens your quadriceps, those big muscles in the front of your thighs. Strong quads help take pressure off your knees when you walk, climb stairs, or stand up from a chair. Heel slides. Lie down on your back, either on a mat or a soft surface like your bed. Keep your legs straight. Now, slowly slide one heel toward your body, bending your knee as far as it comfortably goes. Then slide it back out straight. Repeat this 10 times on each side. Heel slides help keep your knees flexible and improve your range of motion. That means less stiffness and more comfort when moving around. Standing calf raises. Hold the back of a chair for balance. Stand with your feet about hip-width apart. Gently rise up onto your toes, lifting your heels off the ground. Hold for a second, then lower back down. Repeat 10 to 15 times. Calf raises strengthen the lower leg muscles, which support not just your knees, but also your ankles and feet, giving you a more stable and confident stride. Important tips to keep in mind. Start slow. If you haven't exercised in a while, begin with just a few repetitions and build up gradually. Be consistent. Doing a little bit every day is far more helpful than doing a lot just once in a while. Listen to your body. A little soreness is okay, but sharp or shooting pain is not. If something doesn't feel right, stop and talk to your doctor or physical therapist. Warm up and cool down. Gentle movements like arm swings, marching in place, or shoulder rolls can prepare your body. After exercising, try light stretching to relax your muscles. A note on safety: always check with your doctor before beginning a new exercise routine, especially if you have any underlying health conditions, joint issues, or recent injuries. They can guide you toward the safest and most beneficial approach. Your effort matters. What's most important is not perfection, but participation. Even if you can only do a few repetitions to start, that's progress. As you continue, you'll likely notice improved balance, stronger legs, and less day-to-day pain. And most of all, you'll feel more in control of your health. In our next video, we'll talk about another simple, drug-free method for knee pain relief, using heat and cold therapy the right way. It's amazing how a warm towel or a chilled gel pack can make a big difference when used correctly. So don't give up on your knees. They've carried you this far, and with a little help, they can keep carrying you comfortably for years to come. Your body knows how to heal. Sometimes, it just needs the right support. Do your knees feel stiff when you wake up? Or maybe they ache after a long day of walking or standing. If so, you're not alone, and there's a simple, natural way to find relief that's been trusted for generations, using heat and cold. In this part of our journey to relieving knee pain without pills, we'll explore how applying warmth or cold to your knees can ease pain, reduce swelling, and help you move more comfortably. This is one of the easiest, most affordable methods you can use right at home, and it only takes a few minutes. Why heat and cold work? Let's start with a simple explanation. Your body reacts to temperature in powerful ways. Heat therapy helps improve blood flow. When you apply warmth to a stiff or achy knee, it relaxes tight muscles and increases circulation. This helps bring oxygen and nutrients to the area, which can reduce pain and help tissues heal. Cold therapy, often called cryotherapy, reduces inflammation. When your knee is swollen or feels inflamed after activity, a cold pack can calm it down, reduce puffiness, and numb the area to ease the discomfort. Both methods are helpful, but the key is knowing when to use which one. When to use heat versus cold. Here's a simple guide. Use heat if your knee feels stiff, achy, or tight, especially in the morning or after sitting for a while. Use cold if your knee is swollen, feels warm to the touch, or if you've just been walking or doing more than usual. Think of it like this. Heat is for loosening and relaxing. Cold is for calming and reducing swelling. Ways to apply heat safely. There are several safe ways to apply heat therapy. A warm towel. Soak a clean towel in hot but not scalding water, wring it out, and place it over your knee. A heating pad. Electric heating pads are convenient, but always use them on a low setting and never fall asleep while using one. A warm bath or shower. A 10-15 minute soak can loosen up joints and relax your whole body. Keep in mind, don't use heat for more than 20 minutes at a time and never apply it to a knee that's already swollen. Ways to apply cold therapy. Safely, cold therapy can be just as simple. A gel ice pack. These mold nicely to the shape of your knee. A bag of frozen peas wrapped in a thin towel. This works great in a pinch. Cold water soak. Submerging your knee in cool water for 10-15 minutes can also help. Always place a thin cloth between your skin and the ice. Never apply ice directly to your skin, as it can cause frostbite. Limit cold therapy sessions to 15-20 minutes. What Science Says studies have shown that both heat and cold therapy are effective at managing arthritis and other joint pain. According to the Arthritis Foundation, alternating heat and cold, for example using heat in the morning and cold after activity, can provide more complete relief throughout the day. In one clinical review, patients using cold therapy after joint activity reported less swelling and pain, while those using heat therapy before movement experienced better flexibility and less stiffness. Safety tips. If you have poor circulation, diabetes, or nerve damage, consult your doctor before using heat or cold therapy. Check your skin during and after each session. If you notice redness, irritation, or numbness, stop and rest. Avoid extreme temperatures. Warm and cool are best. You don't want to burn or freeze your skin. Make it a habit. Consider building this simple therapy into your daily routine. A warm compress in the morning can prepare your knees for the day. A cold pack in the evening can ease the wear and tear after a walk or time on your feet. This gentle practice supports healing, manages pain, and helps you stay active, all without medication. In our next part, we'll explore a powerful but often overlooked way to protect your knees every day, choosing the right footwear and using supportive insoles. Until then, remember, even small, consistent actions like applying a warm towel or a cold pack can make a big difference. Relief is within your reach, and your knees will thank you. Have you ever come home after a walk and noticed your knees were aching more than usual? You might think it's just age catching up with you, but there's a silent contributor many people overlook: your shoes. In this part of our series on relieving knee pain without pills, we're focusing on a foundation of daily comfort: your feet. Believe it or not, the shoes you wear and the insoles inside them can have a big impact on how your knees feel. That's because your feet are the base of your body. If that foundation is shaky or unsupportive, everything above it, your knees, hips, even your back, can suffer. Let's talk about how choosing the right footwear and using supportive insoles can help you take pressure off your knees, walk more comfortably, and prevent pain from getting worse over time. The link between your feet and your knees: when you walk, your feet absorb the force of each step. But if your shoes are worn out or not cushioned properly, that force travels up your legs and lands right in your knees. Over time, this can wear down cartilage, increase inflammation, and cause chronic pain. It's similar to walking on a hard surface with no padding. Your joints end up doing all the work. But with the right shoes and insoles, you can cushion every step and ease that impact, protecting your knees from unnecessary strain. Research from the Arthritis Foundation and several orthopedic studies confirms that supportive footwear helps improve alignment, reduces stress on the knee joint, and can even slow the progression of arthritis in the knees. What makes a shoe supportive? Let's break it down simply. A good shoe for knee support should have a cushioned sole. This helps absorb shock and protect your knees with each step. Arch support. Proper arch support keeps your foot from collapsing inward, which can twist your knee slightly and cause pain over time. A firm heel counter. This is the part at the back of the shoe that holds your heel in place. A firm heel counter adds stability and reduces strain on the joints. A flexible front. The toe of the shoe should bend easily, allowing your foot to move naturally as you walk. Avoid shoes that are completely flat, like old slippers or worn-out sandals, and skip high heels or narrow-toed dress shoes. These can put pressure in all the wrong places and leave your knees aching. The power of orthotic insoles. Even if your shoes are decent, adding a quality insole can make a world of difference. Insoles, also called orthotics, help balance your foot position, absorb impact, and align your stride. There are two main types: over-the-counter insoles. These are pre-made and sold in most pharmacies or shoe stores. They can offer great support for everyday use. Custom orthotics. These are made specifically for your foot by a specialist. They're more expensive, but if you have serious foot or knee issues, they may be worth discussing with your doctor or podiatrist. Studies show that using insoles can significantly reduce knee pain, especially in people with osteoarthritis or those who walk a lot during the day. When to wear supportive shoes. It's best to wear your supportive shoes during all waking hours, especially if you're moving around the house or walking outside. Many seniors tend to go barefoot or wear soft slippers indoors, but that's when knee pain can quietly build up. Consider getting a pair of indoor shoes with good support that you wear just inside your home. Your knees will thank you. Check your shoes regularly. Shoes wear down over time, even if they still look okay on the outside. A good rule of thumb is to replace walking shoes every 6 to 12 months, or sooner, if you notice the soles are flat or uneven. You can test your shoes by placing them on a table and checking if they rock side to side. That means they've worn unevenly and might be throwing off your balance. Safety. Tips and comfort considerations. If you have diabetes or reduced feeling in your feet, it's essential to choose shoes that don't cause pressure or friction. Always break in new shoes slowly and check your feet for any signs of redness or irritation. And remember, comfort matters. You should never have to break in a shoe by suffering through pain. A good shoe should feel supportive and comfortable from the first wear. Walking with confidence. Every step you take puts pressure on your knees, but with the right support under your feet, each step can become smoother, safer, and far less painful. It's a simple, everyday change that adds up over time. In our next part, we'll explore how maintaining a healthy weight can dramatically reduce knee strain and help prevent further pain. It's not about drastic diets, just small steps that make a big difference. You don't need to suffer with every step. With good shoes and smart support, you can walk with ease and protect your knees for years to come. Have you ever wondered why your knees feel more strained after the holidays or during times when you've gained just a few pounds? It's not your imagination. In fact, maintaining a healthy weight is one of the most powerful and often overlooked ways to relieve knee pain naturally. In this part of our series, we're diving into how even modest weight loss can take a major load off your knees, reduce pain, and help preserve your joints for years to come. No pills, no harsh diets, just simple lifestyle changes that gently support your knees every day. Why extra weight hurts your knees? Think of your knees like the hinges on a door. They're strong, but over time, too much pressure can wear them down. For every extra pound you carry, your knees feel the force of about 4 pounds of pressure with each step. That means just 10 extra pounds adds about 40 pounds of stress on your knees with every step you take. Now multiply that by the thousands of steps you take each day, and you can see how the strain adds up fast. Over time, that pressure can wear away the smooth cartilage in your knees, increase inflammation, and lead to chronic pain. This is especially true for people with osteoarthritis, where the cartilage is already weakened. The good news: small changes make a big difference. Here's the encouraging part: you don't need to lose a lot of weight to feel better. Studies from the Arthritis Foundation and Harvard Health show that losing just 5 to 10% of your body weight can significantly reduce knee pain and improve mobility. For someone who weighs 180 pounds, that's just 9 to 18 pounds. Even a 1 pound loss removes 4 pounds of pressure from your knees, so dropping just 5 pounds takes 20 pounds of stress off your joints. That's a big relief from a small change. How to support healthy weight, gently and naturally. The goal isn't rapid weight loss or strict diets. It's about creating simple, sustainable habits that support your overall health and take pressure off your knees in the process. Eat balanced meals. Focus on whole, natural foods. That means lots of vegetables, fresh fruits, whole grains like oats or brown rice, and lean proteins such as fish, chicken, or beans. These foods not only support healthy weight, but also reduce inflammation, which helps your joints feel better. Watch portion sizes. You don't need to cut out your favorite foods entirely. Just try eating smaller portions or using a smaller plate. This simple change can make a big impact over time. Stay hydrated. Drinking enough water helps keep your joints lubricated and your metabolism active. Sometimes our bodies confuse thirst with hunger, so staying hydrated can also prevent unnecessary snacking. Move gently but often. Even if you're not able to do intense exercise, gentle daily movement, like walking, stretching, or chair exercises, can help you burn calories, build muscle, and support joint health. We covered some helpful exercises in part 1 of this series. What about emotional eating? Many people eat not because they're hungry, but because they're bored, anxious, or feeling low. This is especially true for seniors who may be spending more time alone. If you find yourself reaching for snacks when you're not truly hungry, pause for a moment and ask yourself, what do I really need right now? Maybe it's a walk, a phone call with a loved one, or even just a glass of water. Speak with your doctor. If you're struggling to manage your weight or unsure where to start, don't hesitate to talk to your healthcare provider or a registered dietitian. They can help tailor a plan that's safe and right for your body and health needs. You're in control. One of the best things about weight management is that it's in your hands. You can make small changes at your own pace. And with each step you take, literally and figuratively, you're taking pressure off your knees and giving your joints the support they deserve. In our next and final part, we'll explore natural anti-inflammatory foods and how they can help soothe your joints from the inside out. It's another gentle, drug-free way to feel better every day. Your knees carry you through life. Lightening the load, even just a little, can make every step feel easier. Imagine easing your knee pain not with pills but with your plate. That's right, what you eat can have a powerful effect on how your joints feel. In this final part of our series, we're focusing on the natural healing power of food, especially those known to fight inflammation. If you live with chronic knee pain, you've likely heard about inflammation. It's your body's natural response to injury or stress, but when it stays too long, it becomes a source of pain itself. And one of the best, safest ways to calm this kind of inflammation is through your diet. Let's explore which foods can help soothe your joints, how they work, and simple ways to enjoy them every day. What is inflammation, and why does it matter? Inflammation is like your body's alarm system. When something goes wrong, like an injury or strain on the joint, your body sends extra blood, fluid, and immune cells to the area. That's helpful in the short term, but when inflammation sticks around, it causes pain, swelling, and stiffness. Research shows that chronic inflammation is a major cause of arthritis and knee pain. The good news is that certain foods contain natural compounds that help reduce this inflammation, calming your body from the inside out. Top anti-inflammatory foods for knee pain: fatty fish. Salmon, mackerel, sardines, and trout are rich in omega-3 fatty acids. These healthy fats are proven to lower inflammation throughout the body. According to the National Institutes of Health, people who regularly eat omega-3s report less joint stiffness and pain, especially with arthritis. Try to include fatty fish in your meals 1-2 times a week. You can bake, grill, or add them to salads and sandwiches. Berries, blueberries, strawberries, and raspberries are packed with antioxidants, especially compounds called anthocyanins that reduce inflammation and support joint health. A cup of fresh berries a day makes a sweet, healing snack. Leafy. Green spinach, kale, and broccoli aren't just good for your bones. They're full of vitamin C and K, which protect cartilage and reduce joint swelling. Steamed or sautéed, greens are an easy addition to lunch or dinner. Olive oil. A staple of the Mediterranean diet, olive oil contains oleocanthal, a compound that acts similarly to anti-inflammatory medications, but without the side effects. Use extra virgin olive oil in your cooking or drizzle it over vegetables and salads. Turmeric. This golden spice, commonly used in Indian cooking, contains curcumin, one of nature's most powerful anti-inflammatories. Studies have shown curcumin can reduce knee pain in people with arthritis, especially when taken consistently. Try adding a small spoonful to rice, soups, or warm milk. It's gentle, earthy, and healing. Nuts and seeds. Walnuts, almonds, flax seeds, and chia seeds are full of healthy fats and protein. A handful a day can fight inflammation and give you long-lasting energy without weight gain. Green tea. A soothing cup of green tea contains polyphenols, antioxidants that help slow cartilage, break down and fight inflammation. Replace one sugary drink a day with green tea to support your joints. What to limit or avoid. Just as some foods reduce inflammation, others can make it worse. Try to cut back on processed foods like chips, white bread, packaged snacks. Sugary. Drinks and desserts, fried foods, red and processed meats. These foods can trigger inflammation and worsen knee pain over time. You don't have to be perfect. Just making a few smart swaps can make a real difference. Create an anti-inflammatory meal plan. Start your day with a bowl of oats topped with berries and walnuts. For lunch, try grilled salmon with leafy greens and olive oil dressing. At dinner, enjoy brown rice with sautéed vegetables and a pinch of turmeric. Sip green tea throughout the day and keep fresh fruit or a few almonds handy for snacks. It's not about following a strict diet. It's about gently shifting your choices to support healing. Always check with your doctor. If you take medications or have health conditions like diabetes or high blood pressure, talk to your doctor before making big dietary changes. Some foods like turmeric or green tea can interact with certain medications. The power of small nourishing choices food is not just fuel, it's information for your body. Every bite you take sends signals to your joints. Will those signals stir up more pain or soothe it? You get to decide one meal at a time. We've now explored 5 simple, drug-free ways to relieve knee pain: gentle exercises, hot and cold therapy, supportive footwear, healthy weight, and healing foods. Each one builds on the others, and together they form a strong foundation for comfort and mobility. Thank you for joining this journey. Your body has a natural wisdom, and when you give it the right care, it responds. You deserve to walk with ease, confidence, and joy at any age. If you found this series helpful, be sure to subscribe for more natural ways to stay healthy and active at any age.